Hi, thank you so much for joining us today for Medicare 101. Um, this is presented by the New Mexico Aging and Long-Term Services Department. Our cabinet level secretary is Katrina Hotram Lopez, and I'm Chris Winterode. I'm one of the SHIP coordinators for the state, and I'm going to tell you all about what SHIP stands for in a minute. But first, we are going to go over a little bit of housekeeping. Want to make sure everyone knows that today's presentation will be recorded and posted on the Aging and Long-Term Services Department YouTube channel. In order to keep things going as smoothly as possible, I'm going to ask you to keep your camera off and yourself muted unless you're asking a question. I'm going to stop periodically throughout the presentation and ask for questions. You don't have to wait until the very end. I'm a former teacher, and so I always really think that the answers stick better when they're asked close to the time that you have the question. So I like to take questions throughout the workshop just because you can take the teacher out of the classroom, but you never really stop being a teacher. And again, you can type your questions into the chat if you'd like. You can send them to the whole group. You can send them directly to me, or you can unmute yourself and ask the question. So I just want to make sure that you understand that this presentation is being recorded. If you have your camera on, your face will be part of the recording. If you don't want your face on the recording, then go ahead and turn your camera off. Okay. Yes, ma'am. Do you have a question? Prashant?
Hi.
Hi.
I just got on. There was some difficulty with my getting on. And I see a picture of you and you're talking, and I see a page that says housekeeping with
Perfect. That is exactly what you should see.
That's where I'm supposed to be?
That's where you're supposed to be. So
Okay. She's the only one that came from the other Zoom link. So
good,
just so you know, yeah, I've got everybody here.
Thanks, Melissa. And I would like to introduce everyone to my coworker, Melissa Luna. She is also a SHIP coordinator, and she is going to be with us here today. It's part of her training, and also just, she can help me monitor the chat if you don't mind, Melissa. So I am going to go ahead and
Not at all.
mute you, and we'll continue with the presentation. So you can unmute yourself, or you can type your questions into chat. And I just want to make sure you understand, ma'am, that if you keep your camera on, your face will be part of the video that will be posted onto our Aging and Long-Term Services Department YouTube channel. You're welcome to keep your camera on if you don't mind that, but if you don't want to be part of the video, then you should turn your camera off. Okay. That is our housekeeping, and yes, indeed, you are in the right place for Medicare 101. We're going to go over all of the basic building blocks of Medicare today. We're going to talk about different situations and different programs that support making Medicare more affordable. Today, I'm going to introduce the important consumer assistance programs, SHIP and SMP. We're going to go over all the parts of Medicare, A, B, C, and D, plus Medigap policies, which are also identified by letters of the alphabet, just to keep things interesting. We're going to talk about Medicare enrollment, what your Medicare options are. I'm going to give you some COVID updates. I'm also going to give you updates on Medicare Part B premium costs and deductible changes for 2023. And we're going to talk about Medicare Open Enrollment, which is coming up starting October 15th, just briefly. And I'm going to present some other resources that may be of use to you at time permitting. Okay. So Melissa and I are both part of the New Mexico SHIP program. That stands for State Health Insurance Assistance Program. It's a federal-state partnership that is contracted by the Centers for Medicare and Medicaid to provide free unbiased expert information and assistance for people with their Medicare decisions. We offer counseling, we offer education like the workshop that you're in today, as well as outreach in the community. And this service is for people who have Medicare or are getting ready to start Medicare, but it's really also for family members and caregivers. Often, as people are getting older, their families may take a larger role in helping them with these types of decisions, or at least, wanting to understand it. And those, family members and caregivers are also welcome to access this information. New Mexico SMP stands for Senior Medicare Patrol. This is the part of our agency that's tasked with healthcare fraud prevention. And their job is to help Medicare beneficiaries avoid, detect, and prevent healthcare fraud. This is really important for a number of reasons. Of course, I'm sure all aware of just how big of a target seniors and Medicare beneficiaries have on their back, both in terms of people trying to sell them things and also people trying to defraud them and run scams. So that's a constantly changing landscape. And I'm going to show you a great benefit that we have for people to help protect yourselves from scams and frauds in just a minute. It's also important because reducing scams and Medicare and Medicaid fraud really helps preserve the integrity of the programs and make sure that they're going to be strong and ready to serve people into the future. So, we really try to help educate and inform Medicare beneficiaries how to protect their personal identity. You absolutely never want to give anybody your personal identifying information like your date of birth, even the last 4 digits of your social, unless you are 100% sure of who they are. Medicare is never going to call you and ask for that. You should never have to provide that in order to get a benefit. And Medicare does not approach people with unsolicited benefits. Okay. It's really important. It's also important to make sure you go over your Medicare summary notice, your health care bills, to identify incorrect billing. As we head into Medicare Open Enrollment, I'm sure you've already noticed there's a big uptick in ads. You've probably received 80 gazillion things in the mail from people marketing their Medicare Advantage plans in particular. So we really help protect people from illegal marketing.
Chris, I can't hear you. I'm not sure if you can hear me.
I can hear you. So put in the chat, if you wouldn't mind, if you can hear me. Bobby, I know Bobby already said she could hear me. Abby and White, if you could just give me a little, can you hear me? Okay, so sorry, Melissa, it looks like that's let me just send you a message here. You may want to check your Zoom settings. Okay, so SMP is here to protect Medicare beneficiaries. So before we dive into the meat of Medicare 101, I am going to stop sharing the presentation for just a moment, and we're going to go over to the Aging and Long-Term Services Department website. I'm assuming that most of you have been there already because you're here, and that's how you get to this workshop, is through the Aging and Long-Term Services Department website, but I'm going to give you a brief tour. Okay. So you should be seeing the Aging and Long-Term Service Department website. Couple of you find information about upcoming events, Zoom workshops like the one that you're in right now under news and events. Hover over that, and then you go down to upcoming events, and it's going to show you the workshops we have coming up. So here's today's workshop, and our next workshop that we're offering, and this is really going to be the last workshop, Zoom workshop of 2022, because as we head into Medicare Open Enrollment, this kind of outreach, we just don't have time, the staff, to do that. So on October 12th, we're offering Making the Most of Medicare, Preparing for Fall Open Enrollment. And just like for today's workshop, if you're interested in that, you click on it, and the Zoom link is right here. All you do is click on it, and you're in like Flynn. So definitely come back and check. We will continue the Medicare 101 workshops in 2023, in addition to adding a variety of other kinds of trainings for people on how to get the most out of their Medicare benefits. So I just want to point a few other things out on our workshop before we continue with Medicare 101. We're going to talk later in the presentation in today's workshop about the Medicaid waiver. This is the Medicaid benefit that helps pay for in-home caregiving services for people who have Medicare and need some personal care services. You can register for an appointment right here on our website just by clicking this button. You can also, if you or someone that, a friend, neighbor, family member, you're worried is being abused, neglected, or exploited, you can make an Adult Protective Services report right from our website. You click on this button, it takes you right into the report. Okay, here's where you can sign up for scam alerts. Remember, just now we were talking about the Senior Medicare Patrol is the part of our agency that helps protect people against scams. You can sign up right here from our website to get alerts about the prevalent scams that are happening. And then the other thing that's up here up top is our reverse mortgage education app. It's called Heconomics. I've done education about this incredible tool that the Aging and Long-Term Service Department is offering people in New Mexico. I've done it statewide. I've even done it nationally. And what I find when I'm talking to people out in the community is that a lot of people won't even consider a reverse mortgage because they're so worried about scams and being taken advantage of. So that's exactly why we're providing this reverse mortgage education. It's a financial literacy tool that's free. You can sign up. All you need to do is provide your email address, and you'll be able to get an account for Heconomics. No one will ever look at your information, and it just gives you an opportunity to explore in a zero pressure environment how a reverse mortgage would work for you so that you can decide for yourself whether it's a financial tool that would be useful to you or not. So it's a great app, financial literacy tool that we're offering to people. And really, knowledge is power. The best way to protect yourself is to have the correct information. As we scroll down, there's a lot more on our website. You can find out where your local senior center is, what's for lunch. You can find more information about your rights and how to get legal assistance here on the Elder Rights button. There's just a lot here. You can go into the Conference on Aging button and find out what workshops were offered during that conference and how to get some of that information. I want to go down to the very bottom here to show you where to find this presentation if you want to view it again later. since it is being recorded and it will go on our YouTube channel. If you go all the way to the bottom and look at these little buttons that are right above the ACL logo, this one here that looks like a VCR play button, the 1, 2, 3, 4th one from the left, is the YouTube button. And if you click on that, it takes you right to our Aging and Long-Term Service Department website, YouTube channel, and you can see all of the videos that we have up, right? We've got some of the things about volunteering through the Aging and Long-Term Services Department. We've got some information about adult protective services. Here you see the Medicare Minute from July showing talking about how Medicare covers dental, vision, and long-term care. Here's the previous Medicare 101 from June. So all that information is there right there on our website. Okay. I'm going to now back to our regularly scheduled programming. And I really would appreciate feedback from you about how you like these little field trips. Again, I'm a teacher, so I do like to go out of the classroom into the field. So some people really like the field trip, some people don't. I would really love your feedback. Okay, back to Medicare 101. Medicare is health insurance for adults 65 or older, but also for younger adults who have certain disabilities and anyone who has end-stage renal disease. So if you have end-stage renal disease, kidney failure, you're on dialysis, no matter your age, if you apply for disability, you're going to go straight onto Medicare. Okay, Medicare eligibility. If you are 65 or older, when you turn 65, you'll qualify for Medicare if you collect or qualify to collect Social Security or Railroad Retirement benefits. Or if you're a current U.S. resident and a U.S. citizen or a permanent resident who's lived in the U.S. for 5 years in a row before applying for Medicare. And basically that means, like someone who has their green card, permanent resident status. They have to also have resided in the U.S. for at least 5 years. If you have a green card, even if you're 70 years old and you've only been in the country for 3 years, you're not going to qualify for Medicare. You have to have been here for 5 years. Okay, if you're under 65, you will qualify for Medicare if you have been on disability for 2 years. If, as we mentioned before, there are some conditions where there is no waiting period, such as end-stage renal disease, or other conditions like ALS. So when people often think that Medicare is just for retirees, but it's not. It's also for people who have disabilities. Okay, how do you get enrolled? If you're already signed up to receive your Social Security retirement check, you're going to be enrolled automatically in both Medicare Part A and B. If you're not, and I talk to more and more people who are choosing to delay collecting their Social Security check until it reaches the maximum benefit, then you will have to actively enroll through Social Security. Okay, I think the easiest way to do it is online at www.ssa.gov. You can call our office for assistance with that if you need help. I help people apply for Social Security all the time on the Social Security website, or you can also go into your local Social Security office and apply. I just double checked this yesterday. All Social Security offices in New Mexico are open again. They were closed throughout the pandemic and then they opened for limited hours. Now they should all be open. The initial enrollment period for Medicare is 7 months long. It starts 3 months before you turn 65, includes the month of your birthday, and extends for 3 months after the month of your birthday. So it's a good long period to get enrolled in Social Security, in Medicare. Remember that that happens through Social Security. If you call Medicare and you don't already have your Medicare card, Medicare isn't going to be able to give you any information because you're not in their system yet. Okay, just to recap, that initial enrollment period is 7 months long, and the month of your birthday is smack dab in the middle of it. If you miss that for some reason, you can enroll during the general enrollment period. The general enrollment period is the same every year from January 1st through March 31st. If you enroll during the general enrollment period, your coverage is going to begin July 1st. They're talking about changing that so that enrollment starts the month following your application, but that hasn't happened yet. You also may have a special enrollment period. For example, if you have elected to delay starting Medicare because you're still employed and covered under your own or your spouse's active employer insurance, you will get a special enrollment period to enroll in Medicare when that coverage ends. You may also have a special enrollment period when you're entering or leaving a long-term care facility. You can also change your coverage when you move, and that's less related to enrolling in Medicare A and B and more about changing your prescription drug or your Medicare Advantage plan coverage. When you are enrolled, you'll get your Medicare card, and it looks like this. If you keep it, and it'll say what parts of, if you're enrolled in the basic parts of Medicare, Part A and Part B. We're going to go over those in a minute. Your card is only ever going to show Part A and Part B. It's not going to show Part D. It's not going to show Part C. Okay, so don't worry if your card just says A and B. That's all it's ever going to say, because those are the parts that stay the same. You can change your Part C coverage every year. You can change your Part D coverage every year. Right, so those things change. They're not going to be on your permanent Medicare card. Your card's only going to show A and B. If you don't want to be enrolled in Part B, you can follow the instructions on the back of the card to return and refuse Part B. It's simple to do. I highly recommend you pay careful attention before you do that. Make sure you understand the implications for both your medical care and your future costs before you do that. And you can always call us to run it past somebody before you make such a critically important decision about your Medicare. But you do have the right to refuse Medicare coverage. Okay. Before we move on to the building blocks of Medicare, does anybody have a question about enrollment? And you can either unmute yourself and ask, or you can type it into the chat. Pull the chat back up over here and see if I've. Hi, Nicole. Okay. I'm not seeing anything in the chat, so we're gonna move on. Whoopsies, sorry. All right, so I think of Medicare as a series of building blocks, right? It's more fun if you think of it as playing with Legos. Basically, how you get your coverage is going to depend on which parts you put together. So Part A, if you put together your Part A hospital coverage, Part B doctor coverage, and a Part D prescription drug plan, you will have what we refer to as original Medicare. With this type of coverage, you're getting your hospital and doctor coverage directly through Medicare. You're not going through a third-party insurance company. And the people who prefer this type of coverage, often they're people who are planning to be traveling during retirement, are going to be visiting and spending extended amounts of time with friends or family in other parts of the state or in other states. With this type of coverage, you can see any doctor in the country who accepts Medicare. If the doctor accepts Medicare, you can go to them. Also, people who are research oriented and want to, if they come down with a health condition, they want to find out where is the best place to get treatment for that and be able to go there. They're going to be happiest with original Medicare, probably. Original Medicare pays 80%. You're responsible for 20%. And that's where the Medigap policies down here at the bottom come in. That's an optional coverage that you can add if you have original Medicare, and it pays all or part of your 20% of the covered benefits. So with original Medicare, you can expect to have higher monthly premium costs. You're going to have for most people, Part A is free. If you've worked for at least 40 quarters and paid into the system, that's going to not have a premium. Part B has a premium. The new premiums for 2023 just came out yesterday afternoon. So in 2023, Medicare Part B premium is going to be $164.90 for most people. Okay, we'll talk a little bit about how that differs depending on your financial situation later on in the presentation. But that's the general Part B premium for 2023, $164.90. You're going to have a premium for your Part D prescription drug plan, and you're going to have the premium for your Medigap policy. These tend to be pretty expensive. Just as a ballpark, when I'm working with people on, just trying to figure out their cost benefit analysis, I usually say, if you're going to go with original Medicare with a supplement, just kind of mentally double your Part B premium. And that's what you can expect to pay for your Medicare monthly Medicare costs. So instead of $164.90, it'll be a little over $300. Okay, when you add in the premium for your prescription drug plan and the Medigap policy if you choose to get one. So it has a higher monthly premium cost. The flip side of that is once you've met your Medicare Part B deductible, which again for 2023 is going down just a little bit to $226, then you won't have any out-of-pocket costs when you get care. You go to the doctor, you won't have a copay. You go to the hospital, you won't have any copays or hospital charges. So depending on your financial situation, depending on your health, this can actually be a very cost-effective way to get your Medicare, especially if you plan to travel and you don't want to have to worry about networks, and you want to be able to research where to get your care and be able to go there without having to jump through a bunch of hoops. The other downside to original Medicare is that it does not include any dental, vision, or hearing coverage. So if you want dental, vision, or hearing coverage and you have original Medicare, you're going to have to enroll in a standalone policy for that. Sometimes retiree organizations have those plans available. There are also a number of companies in New Mexico that offer standalone dental and vision plans. Okay. The alternative to original Medicare is a Medicare Advantage plan. Medicare Advantage plans in New Mexico are mostly HMOs or PPOs. People are pretty used to this type of care. This type of getting their care through this type of insurance. It's going to function pretty much like whatever employer health policy you've had. HMO stands for Health Maintenance Organization. They tend to have a smaller network of providers that's more local. PPO stands for Preferred Provider Organization. They tend to have more extensive networks and a bigger list of providers. So when you join a Medicare Advantage plan, you're basically joining a policy that's offered through a third-party insurance company that bundles together your Part A hospital coverage, your Part B doctor coverage, and a Part D prescription drug plan into an HMO or a PPO, okay? If you have a Medicare Advantage plan, you cannot have a Medigap policy. So with a Medicare Advantage plan, you tend to have lower monthly premium costs. You're still going to have your Medicare Part B premium, which again for 2023 is going to be $164.90. Plus, you'll have the premium for your Medicare Advantage plans. And the Advantage plan premiums vary wildly. They're all over the map. Everywhere from a $0 additional premium up to, in the range of $200 a month, right? So there's a lot of different Medicare Advantage plans available, and I will show you later on in the presentation how to see what they are and kind of go through and evaluate them. Your costs, your costs when you get care with a Medicare Advantage plan, you're going to have set co-pays for every service you receive. So kind of the flip side of the lower monthly premiums with a Medicare Advantage plan is that you have to get your care within their network, or if you have a PPO, you may have access to out-of-network providers, but you're going to pay a higher copay. And you'll have copays for every service that you receive. So I have actually talked with people who have a Medicare Advantage plan and they've entered a health crisis of some sort, and they just are like, I have copays every time I turn around. It's driving me crazy. Can I switch over to original Medicare with a Medigap? So it can actually be, depending on your health needs, more cost effective to be on original Medicare with a Medigap. So it really, really depends. There is no right or wrong answer about which type of coverage to choose. It's a matter of thinking about your health situation, thinking about your budget, thinking about how you like to get your care, and understanding each type of coverage, whether it's original Medicare or Medicare Advantage plan, well enough to match that with your needs and preferences. The other thing that I want to mention before we move on to the next slide is that if you think you might be interested in original Medicare with a Medigap, it is to your benefit to enroll in that when you're first eligible for Medicare, because the Medigap policies have what's called a right of guaranteed issue period, and that is only for the first 6 months that you're on Medicare. What the right of guaranteed issue means is that during that first 6 months after you start Medicare, if you apply for a Medigap policy, they pretty much have to take you. Right? They can't ask for a health screening. They can't decline you based on pre-existing conditions. And so if you want a policy, they're going to give it to you. If you're like, well, my health needs are pretty low right now. I don't want to spend all that money on healthcare I'm not getting. I'm going to join a Medicare Advantage plan. And then 5 years later, your health situation has changed and you want to go to original Medicare with a supplement or a Medigap policy. You may or may not be able to get one at that point, and it may or may not be affordable because you will no longer have a right of guaranteed issue. The companies can require a health screening. They can decline you based on pre-existing conditions. And they can also, if they do issue you a policy, they can charge you more based on your health and your age. So before this is probably the key decision that you're going to make when you start Medicare, because you can get a Medigap policy later, but it may, or I mean, sometimes people actually can't get one. They can't find a company that will issue them one if they have a serious health condition. And the cost also goes up. So if you want to talk to a SHIP counselor before you make this decision, you can absolutely call the ADRC and make an appointment. Before we move on to the individual parts in a little bit more detail, does anybody have a question about original Medicare and Advantage plans? All right, you can always put it in the chat if you think of it later. All right. So what are the building blocks? No matter which choice you make, whether you go with original Medicare or an Advantage plan, you need to have Medicare Part A. It is the hospital part of Medicare insurance. And as I mentioned before, for most people, if you've worked for at least 40 quarters and paid into the system, this is going to be free. It's not going to have a premium attached. If it does have a premium, this happens sometimes with people who don't have the work history, or maybe you've worked in a non-traditional occupation and not paid into the system, or if people have been disabled and unable to work. Please do call us. We can often help so that you can get this essential part of your Medicare coverage without the premium. It covers your inpatient hospital stay, inpatient skilled nursing facility, blood, home health care, and hospice care. Now, what does all this mean? So when they talk about inpatient hospital stay, this is really covering the room, the food. It's not covering the doctor who walks by, sticks his head in, and then bills you, right? That's covered under Medicare Part B. So this covers just the hospital part, which is the room, the food, drugs. When they talk about home health care, they're not talking about personal care services. So if you need someone to come in and do light housekeeping, help you with meals, help you run errands, take you to your doctor's appointments, that is not covered by Medicare. When they refer to home health care here under Part A, what they're talking about is skilled nursing services, therapy services delivered in your home. Okay, so your wound care, if you have physical therapy coming to your house, that sort of thing is covered under Medicare Part A, but not personal care services. So as I have already mentioned a number of times, most people aren't going to pay for Part A. If you do have to pay, I don't have the number right in front of me, but it's over $400 a month. It's crazy expensive. So if you or someone who is not eligible for free Part A and they're thinking, well, I guess I can't have that because I can't afford that, please have them call us, right? We can help. We can help work through their situation, see if they're eligible to get free Part A another way. Okay. Part B is the doctor coverage and outpatient surgery and supplies, labs, x-rays, MRIs, all that good stuff. It also covers durable medical equipment, and that includes oxygen equipment. It includes, if you need a hospital bed, or if you need any equipment, right? The big one is oxygen, but it also covers all kinds of other things, wheelchairs, all kinds of stuff, okay? Your diabetic supplies are covered under Medicare Part B. So that's the needles, the test strips, all that sort of stuff. You're going to need a prescription drug plan to cover the insulin, but the supplies are covered under Part B. And it also includes preventive services. Medicare has a host of preventive services. Your annual visit, of course, which is not the same as a physical. It's different and has specific parameters on an annual visit. But it also, there's programs to help people lose weight. There's diabetes programs. There's all kinds of things that are available under preventive services through Medicare. And people don't take enough advantage of that. All right, so I have up here still the cost for 2022. As I mentioned before, the standard Part B premium is going down in 2023 to $164.90, and the deductible is going down to $226. If you have original Medicare, you're going to be responsible for 20% of the costs for your covered services. Many preventive services have a zero copay for people or coinsurance. Medicare covers the full cost of the preventive services. Outpatient mental health services and hospital services are covered under Medicare. Sometimes I get questions about how Medicare covers mental health services, counseling, things like that. That is covered by Medicare at 80%. And, the same with the durable medical equipment. If you have a Medicare Advantage plan, you're going to have a set copay for whatever your covered services are. And it varies, again, it varies wildly from plan to plan. Most plans, their copays are roughly 20%, but that's not true of all of the plans. Some of them have lower copays. Medicare Advantage plan can charge you a lower copay than 20%, but they cannot charge you more than that. Okay, so it's good to know what your original Medicare covers, just so you are aware that if you are in an Advantage plan, they can charge you less than that. They can't charge you more. Okay. Those basic costs for those two basic building blocks of Medicare Part A and Part B, no matter what other coverage you choose, you're going to need to have both Part A and Part B. Do you have any questions about that? Sounds like you do. You unmuted yourself here. Do you have a question, Prashant?
Oh, thank you. I'm sorry, I'm trying to figure out how to work the screen.
Nope. Okay. Well, somebody asked me at the beginning, what affects those costs? So we talk about here the standard Part B premium. For some people who are low income, there's what's called a hold harmless clause, and they are not impacted by or not impacted as much by the premium increases that Medicare Part B can have from year to year. So there may be some people who are low income whose Medicare Part B premium has been frozen at an earlier premium rate. There are also some Medicaid programs that we're going to talk about later that help with those basic Medicare costs to keep your Medicare affordable. And I'll tell you about that in a little bit. On the other end of the scale, if you have more income, you may be assessed what's called an income-related Medicare adjustment amount, or IRMA. Okay, so if you have a higher income, you actually may pay more than the standard Part B premium based on your income. If you're assessed an IRMA charge, an IRMA add-on to your Medicare Part B premium, and your income changes, you can request an adjustment. You can find the information about how to do that on medicare.gov. You can also call us and we'll help you with that. So the income does have some impact on how much your Medicare Part B premium is. Your Medicare is not dependent on income. I mean, sometimes I talk to people who worry that they're going to lose their Medicare if their income changes, and you're not. The only way you're going to lose your Medicare is if you don't pay the premium. If you find yourself getting into trouble with that, call us. We may be able to help make that more affordable. Okay, so a few slides ago, I showed you how to decline or opt out of Medicare Part B. I highly recommend that you think very carefully before you do that, because there are lasting implications if you decline Part B and you don't have what Medicare calls creditable coverage. So the only creditable coverage means as good or better than you would have through Medicare, that Medicare accepts is your own or your spouse's active employer group health plan. So this cannot be a retiree plan, can't be COBRA, right? If you're still working and covered under your employer's group plan or covered under your spouse's group plan and they're still working, then you can decline Part B until that coverage ends and you won't accrue penalties. If you decline Part B, because the most frequent cases that I work with are people who have access to health care through the veterans clinics or through Indian Health Services. Neither of those health benefits is an insurance. So it's not considered creditable coverage by Medicare, and you will have penalties if you opt to join Medicare Part B later. Okay, so you want to make sure before you say no to Part B that you really understand both the current situation and any future impacts. So call us, don't just do that. Again, COBRA is not considered an active employer group health benefit. It's not considered credible by Medicare. Retiree coverage, if you have a retiree plan that's not Medicare, they're not considered an active employer group health benefit. You will be exposed to penalties if you continue with that instead of enrolling in Medicare. I've talked to people who said, oh, I don't need Medicare, I have TRICARE. Well, TRICARE requires Medicare to be the first payer. They won't pay unless Medicare has paid first, or there's been a denial from Medicare, okay? So please, before you decline Medicare Part B, call us to make sure you're not getting yourself into trouble. So I've mentioned several times the late enrollment penalty, or the penalty for Part B if you're not enrolled in a creditable type of insurance. So the penalty for Part B is 10% for each year that you did not have Medicare or an acceptable creditable coverage. If you've been under your own or your spouse's active employer insurance, you're not going to have a penalty. You're going to have to provide Medicare with some documentation showing that you had that coverage, but then you shouldn't have a penalty. If you didn't have creditable coverage, you will have a penalty. It's 10% for each 12-month period. So for example, if the premium for Part B is $164, your penalty will be $16.40. That's $16.40 added on to the Part B premium. So, that brings it from $164 up to $180 a month. And you pay that much forever. You pay the penalty forever. It's not for a limited time period. If you have gone longer, if you've gone 2 years instead of $16, it'll be a $32 penalty, etc. It builds up like that. You know, if you go 10 years and then try to enroll in Part B, you're going to double your premium. Okay. So you really want to be careful before you opt out of Part B. You do, people, as I mentioned before, if you continued under your employer's active insurance and decided to enroll in Part B when you retired or when your spouse retired, you get a special enrollment period. You'll have to provide that documentation, and then you shouldn't have any penalties. You have 8 months to get that taken care of. Most people try to get it taken care of before that because they don't want any gaps in their coverage, but that's how long the special enrollment period is. Okay, so as I mentioned before, if you want a Medigap policy, by far the best time to do it is when you initially become eligible for Medicare, because you have that right of guaranteed issue period. So you have to have Medicare Part B in order to enroll in a Medigap. Also, you have to have Part B in order to enroll in a Medicare Advantage plan. So if you want either of those types of coverage, you really need to accept Medicare Part B. Also, if you have TRICARE for Life or any other type of insurance that requires Medicare to be the first payer. Okay, if you've decided to enroll in Medicare, in original Medicare, what you're going to do next is you're going to add a Part D prescription drug plan. These are also offered through third-party insurance companies. And the reason for that is that they are really based on a local network of providers, mostly pharmacy providers. Okay. The drug plans vary. Your costs for your medications, your co-pays, the premiums are going to vary from plan to plan. You have to have either Part A or Part B to get a drug plan. So remember I was telling you before, for an Advantage plan or a Medigap, you have to have both Part A or B. You can get a prescription drug plan if you have either Part A or Part B. You must live in the service area for the plan you're enrolling in. Now, if you go for a period of time without prescription drug coverage, you will also be exposed to penalties. So I talk to people sometimes who say, well, why should I enroll in a drug plan? I don't take any medicine, right? I'm healthy, I don't take any drugs. I don't believe in drugs, right? All kinds of things. And what I remind people is, you know, we don't have insurance just for our current needs. We also have insurance just in case we, you know, get hit by a bus and things change, right? So you don't, and also, you know, whatever our current pandemic situation is, the fact is, you know, that we have more challenges to our health now than ever. And if you were to become ill with COVID or anything else, you might need medications, right? And you don't want to have to pay for that out of pocket. So it's a good idea to have the coverage. Again, the monthly premiums for the prescription drug plan are all over the map. In 2022, I think the lowest premium that I saw was somewhere around $7.60. So you can enroll in Part D prescription drug coverage, and it doesn't have to be a huge hit to your monthly budget. Whereas if you wait or you need prescription drug coverage and you don't have it, it's going to cost you a lot more. Okay, so the updates didn't include changes to the Part D deductibles, the updates that CMS put out yesterday. That doesn't mean they're not going to change but I don't have the updated numbers for 2023 right now, so we're just going to work with these. The deductible for prescription drug plans for this year are $485. And again, that's the maximum. Many prescription drug plans have a lower deductible. Okay, they can't charge more than that. The average base premium for prescription drug plans is $33.06. That was from 2021. That's just a number to help you kind of mentally compute your budget needs. You know, like I mentioned just a minute ago, when we look at the actual plans, the premiums are going to be all over the place. And the lowest one, I mean, there are definitely some plans available in New Mexico for under $10 a month. And the copays and coinsurances are also going to vary from plan to plan quite a bit. Not only the coinsurance or copay for your medications, but those, even within the same plan, those can vary significantly based on where you pick up your drugs, which pharmacies are in network or preferred for the plan that you sign up for. So there's a lot to consider when you're signing up for these. We provide that counseling for free. We're not selling anything. So if you want help figuring out and making sure you've considered all the factors on what's going to impact your coverage, we're happy to help with that. And there'll be contact information at the end of the workshop. Okay, if you've gone for a period of time without a Part D prescription drug plan, you will have a penalty. It's much smaller than the penalty for not having Part B, right? It's only 1% of the national base premium, but instead of year by year, it's multiplied by how many months you went without coverage. So if you went 2 years, this example shows how much your penalty would be if you went for 24 months or 2 years without prescription drug coverage. 24 times 1% of that $33 monthly premium average is 33 cents. So that's a total of $7.92 for your penalty. That will be added on to your premium for your prescription drug plan for eternity. Okay, it's a lot less than the Part B penalty, but you do carry that forever. So, you know, it really is, I think, in most people's best interests to sign up for a prescription drug plan, even if they're not currently taking any medication. All right. The last component of original Medicare is a Medigap policy, also known as supplemental Medicare supplement. These are, again, offered through third-party insurance companies. The Medigap policies are identified by a letter of the alphabet, and I'm going to show you where to find information about that on Medicare.gov in just a sec. They cover all or part of your 20%. Remember, with original Medicare, Medicare pays 80%, you're responsible for 20%. So I'm going to stop sharing here, and we're going to take a little field trip to Medicare.gov so I can show you where to find that information. So let me share another screen here. Okay, so we should be looking at the lady with the little green dotted line around her head. This is the Medicare.gov website. It says right here at the top, you know you're in the right place when you see the American flag and it says an official government, an official website of the United States government. You do not want to Google Medicare. Please don't do that. I've done it and it is scary. Okay. When I'm looking for information about Medicare, this is the only place I go. Everything you need is going to be here. So if we want to look at the Medigap policies, we're going to go up here on the top under health and drug plans. I'm going to click on that. And over here under Find and Compare on the drop-down menu, it says Find a Medicare Supplement Insurance, in parentheses, Medigap Policy. So I'm going to click on that. And it's going to take me here. Now, I am not going to put in the zip code yet, because what I want to do first is show you how to see the benefits of each of the different types of Medigap policy. You can click on that and it pulls down this little chart. The Medigap plans are identified by the letters of the alphabet across the top, and down the side are the benefits that a plan can include. They don't all include all of the benefits, okay? So how do we read this? We're going to go benefit by benefit across. So Part A, coinsurance and hospital costs. So if you want a plan, all of the plans have a green check mark. They all cover, what that means is they all cover your 20% of Part A coinsurances. Part B coinsurance, right? This is the 20% that you are responsible for when you go to the doctor. We can see that plans A through G have a green check mark. That means they cover your full 20%. Plan K has a 50% in here. That means they cover half of your 20%. They cover 10%, you're still responsible for 10%. So just for easy math, if you go to the doctor and the charge for the visit is $100, Medicare is going to pay $80. If you have a K supplement, it's going to pay $10 and you're going to owe $10. Okay. The L plan covers 75%. Again, with that same easy math, $100 visit, Medicare pays $80. The L supplement will pay $15 and you're going to owe $5. Okay. On a doctor's visit, that's not so much. When we get down to nursing home stay, that can be quite a bit, right? So it's important to know these plans tend to have lower monthly premiums. They're going to cost you less, but they're also going to cover less, okay? M and N also have check marks. Blood, same thing, right? All of these policies cover it. K and L cover a percentage. Same thing for Part A, hospice. Here's where the rubber meets the road as far as I'm concerned. Skilled nursing facility, right? A lot of times people, you know, nobody wants to think about ending up in a nursing home or a rehab. But if you need a hip replacement, if you need a knee replacement, often people end up, you know, spending some amount of time in rehab, in an inpatient rehab. It's an important benefit that you may need. Medigap plans A and B do not pay your 20% of that, right? C, D, F, and G, M, and N cover your 20% of that. And again, K and L cover a percentage of your 20%. The Part A deductible, that is a little over $1,500 per benefit period. You can have multiple benefit periods in a year. What that means is if you have original Medicare and you go to the hospital, you have to pay that $1,500 deductible before Medicare kicks in, right? So this, to me, this is a really important thing. If I'm going to get a supplement, I want it to cover that. The Medigap A is the only one that does not cover that deductible, right? And of course, K and L cover a percentage. The Part B deductible, we can see that hardly any plans cover that. You can't get a Plan F now. This is still here for the people who are grandfathered in. It's not available to people who turned 65 after 2019. C is the only plan that covers the Part B deductible. But as I told you, the Part B deductible for 2023 is only $226. It's not a huge cost. I think that's part of the reason most plans are just not covering it. Okay, so the first thing that somebody who's considering a Medigap policy should do is spend some time with this chart. Make sure you understand what the benefits are, which plans cover the benefits that are important to you, before you then go looking to see what plans are available in your area. We can, your SHIP coordinators, your SHIP people here in the Aging and Long-Term Services Department can give you a quote for the plans that you're interested in. You just need to call us and make an appointment. Okay, so that is important. I'm going to click over here on the Medicare.gov site. That takes us back to the landing page. As of October 15th, this is going to look different because it's going to be focused on Medicare Open Enrollment. But for now, if you want to look at prescription drug plans or Medicare Advantage plans, you click right here under the little briefcase on finding health and drug plans. And all of the plans that are available in New Mexico, you can look up yourself here. Now, if it's overwhelming, you want to make sure you're not missing anything, we are happy to help you with that, right? I do this with people all the time. All right, back to our regularly scheduled programming. Whoops, I don't want to end the meeting. I want to share my screen again. Okay. All right, does anybody have questions about supplements before we move on? Okay. If you have questions after this, your brain is probably exploding. If you have questions later, you're welcome to give us a call. Okay, so this is just a slide that kind of shows the chart and what it looks like on Medicare.gov, but we did that for reals, so I'm going to skip on past this. If, on the other hand, you think a Medicare Advantage plan might be what is going to be a better fit for you, we're going to talk about that for a minute here. It's really important to understand that Medicare Advantage plans are not a separate Medicare benefit. It's still Medicare, okay? Medicare Advantage plans still have to follow all of the rules set by Medicare, and they cannot exceed the charges allowed by Medicare. A lot of times people will tell me, oh, I don't have Medicare, I have a supplement, I have whatever, United Healthcare. I'm like, well, that's not actually a supplement. It's a Medicare Advantage plan, right? And as you are now very well educated on, supplements are a whole different type of coverage. They are contracted through a private insurance company. Most of the Advantage plans include Part A, B, and D, although there are some Advantage plans that don't include prescription drugs. They all include A and B. Some of them don't have drug coverage. So you got to be a little careful about that. As I mentioned before, you have to have both A and B to get a Medicare Advantage plans. Since they're based on networks, there are different plans available in different areas. So you have to be in their service area. And if you have end-stage renal disease or you're on dialysis, you need to be super careful before enrolling in an Advantage plan because you're probably going to be better off with original Medicare. This slide still says you can't enroll in one if you have end-stage renal disease. There are some plans that accept people who have end-stage renal disease, but you got to be really careful about it. So talk to us if that's your situation. The costs for a Part C Medicare Advantage plan vary wildly. They're all over the map. You are going to have your Part B premium, right? So that for 2023, that $164.90 is something that you can count on. But the additional premium for an Advantage plan vary anywhere from zero, like I said, to it can get almost as pricey as a Medicare supplement. And you're going to have set copays for whatever services you receive. Again, it's really important to know that you cannot, if you opt for an Advantage plan, you cannot enroll in a Medigap policy or a supplement. It's either or. Okay. Most of the Medicare Advantage plans in New Mexico are either HMOs or PPOs. There are a few private fee-for-service plans, If you qualify for Medicaid in addition to the Medicare, or if you have certain health conditions, you might qualify for a special needs plan. And there is, I think, one medical savings account available. So these are the types of coverage that, the types of plan that you may have access to if you enroll in an Advantage plan. They have to include all of the services covered under original Medicare A and B, but they can include additional benefits. Most of them, and they advertise heavily on the vision, hearing, and dental coverage. They may also include additional benefits like an over-the-counter drug benefit or a Silver Sneakers gym membership, right? So Medicare Advantage plans really try to lure people in with the additional benefits that you may be able to get if you enroll in their plan. All of the information is available in the Medicare and You handbook. If you didn't get one in the mail, you can go to medicare.gov and there's an electronic version available. You can also request that they mail you one. All right. Also, on the medicare.gov website, there is a great section on getting started with Medicare. Right? If you're, and again, it'll go over all of those basics of Medicare, the parts, the general costs, how it works, what to do if you're working past age 65, how to sign up, when your enrollment periods are, how to join a plan, and then what to do during your first year on Medicare to make sure you're really taking advantage of all of the benefits that are available to you. This is a great thing, and I really encourage people to check it out when they're, even if you're not just starting Medicare, you want to especially look at this step 4, using Medicare, to make sure you're taking advantage of all of the benefits that are available to you. All right, I've mentioned earlier that there are some Medicaid programs that are designed to help keep Medicare affordable. The main one is called the Medicare Savings Program. This is a partial Medicaid benefit for low-income people that pays the Medicare Part B premium for you so that you don't have it taken out of your check. And basically, as an individual, if you make $1,549 or less, you're going to qualify for one of these programs. Now, sometimes I talk to people who are really hesitant to apply for any kind of Medicaid because they've heard about the Medicaid Estate Recovery Program, right? And they're like, I don't want Medicaid to come after my house, right? So I just want to reassure you that this program is not subject to that. There is no estate recovery for Medicare savings programs. There is really, as far as I'm concerned, there is no downside whatsoever to applying for a Medicare savings program. This program exists entirely to help make Medicare more affordable for people on a limited income. So if you make $1,549 or less as an individual, or the married couple limit is $2,080, then you're going to qualify for this benefit, and it's going to put that Medicare Part B premium back into your bank account every month. You can apply for this online at the Medicaid website, which is www.yes.state.nm.us, or you can call us and we'll help. I help people, I go online and help people apply for this all the time, right? It takes me about 15 minutes. We will need to set up an account for you on Yes New Mexico, but we don't record or keep any of that information. We're just acting as your fingers if you either don't have a computer or don't feel confident doing that on your own. If you qualify for the highest level of Medicare Savings Program benefit, which of course corresponds with the lowest income, that income limit is $1,153 for an individual or $1,546 for a couple. If you, that benefit is called QMB or Qualified Medicare Beneficiary. It pays all of your copays or coinsurances in addition to that monthly premium. So this is a great benefit. And if you think you might be under those income requirements, I highly encourage you to apply. They don't look at assets at all. Nobody's going to ask how much money you have in the bank or if you have any investments. This is based on income only. Okay. The other main Medicaid benefits for people who have Medicare are the home and community-based waiver and the institutional care waiver. These are full Medicaid benefits. You may recall that earlier in the workshop I mentioned that Medicare does not pay for personal care services or caregiving. If you need that, then the home and community-based waiver is the benefit to apply for. This is the full Medicaid benefit that helps pay for in-home caregiving or assisted living facilities. It does have both income and asset requirements, as well as medical requirements for eligibility. You have to be at what's called nursing facility level of care in order to qualify for the benefit. The income limits are higher than for the Medicare Savings Program. So if you or someone you know is in need of just a little help, somebody to help with like housekeeping, meals, running errands, getting to the doctor, and with that support, we'll be able to remain in their own home. Absolutely call us or go to our website and click on that home and community-based waiver button to make an appointment to get registered for the benefit. You cannot apply for the home and community-based waiver directly from Medicaid. It has to go through our office. And that's because of the more complex eligibility requirements for to determine a person's medical need for assistance. So if somebody needs in-home caregiving, go to the Aging and Long-Term Services Department website to make an appointment or give us a call. The other benefit is the institutional care waiver. Again, it's a full Medicaid benefit, and this is for people who are in a skilled nursing facility or a rehab. You can't apply for it until you're actually in the rehab. Medicare pays for the first 20 days. This benefit is designed to kind of dovetail in so that as the Medicare benefit ends, Medicaid is ready to pick up. So generally speaking, the facility will help you apply, but if you need more assistance, you can always call us. Okay, there's our website again. I just want to remind you, here's the Medicaid waiver button. We've already spent some time here, so I'm going to move on. If you call us at the Aging and Disability Resource Center, and that's the 1-800-432-2080 number, you're going to speak to an options counselor. They're going to ask, what can we help you with? You can ask any question under the sun. I cannot emphasize this enough. These people are amazing. And what they work to do is match you with the resources that you need in your community. So they have access to a ton of resources from the local, state, federal level, private, nonprofit. So if you need something, give us a call. We also offer short-term assistance. For example, as I was mentioning earlier, I can help you with applications. The SHIP program, in addition to educating people about Medicare, we also help with issues. We help people with appeals. We help people straighten out coverage issues that they're having. If you think you've been the victim or the target of a scam or a fraud, our Senior Medicare Patrol will help with that. We also have a prescription drug assistance program. Sometimes even with insurance, the copay on some of these medications is so high that people can't afford it. And we really don't want anyone not taking their medication as required or rationing it because they just can't afford it. So if you or someone you know is having issues with high prescription drug copays, definitely call us. Okay, and the number to reach, this is the Aging and Disability Resource Center, is the call center for the state. The number is 800-432-2080. And you can also reach us at our website, www.nmaging.state.nm.us. Okay. I always like to pitch the Affordable Connectivity Program. This is an amazing federal program that basically, if somebody is low income, if you qualify for Medicaid, if you would qualify for any of those Medicare savings programs that I mentioned before, you're going to qualify for this. And it helps pay for your internet. Okay. Up to a $30 a month discount on your internet services. So this is the website to go to get more information about that. It is a great program and not enough people take advantage of it. This, as I mentioned earlier, if you want to apply for the Medicare Savings Program that helps pay the Medicare Part B premium, this is what the website looks like, and it's www.yes.state.nm.us. Also, you know, if you get halfway through and you're all like, I thought she said this was going to be easy and I can't figure out what I'm supposed to put here, just call us and we can help you with that. Okay. Just quick, I want to just remind people, if you're not already aware, Medicare will pay for both your COVID vaccination and tests. Okay. You're also eligible for monoclonal antibody treatment. Medicare covers telehealth during the public health emergency. And despite the fact that President Biden the other day said that the pandemic was over, the public health emergency is still in place. So telehealth benefits are covered whether you have original Medicare or a Medicare Advantage plan. You can also get up to 3 months of prescriptions at a time during the public health emergency. So usually Medicare, if you're picking your drugs up at a pharmacy, you have to do it 1 month at a time. Right now, until further notice, you can still get 3 months at a time. You just have to request it. I always want to let people know how they can get a new vaccine card if they lose theirs. And you go to www.vaxviewNM.org. You can request a new vaccination card if you've lost yours. Okay, I already talked about that. I also just want to take a moment to mention again that we're heading into Medicare Open Enrollment. If you are just starting Medicare, if you're not on Medicare yet, Open Enrollment is not for you. Okay, Open Enrollment, the one thing you can't do during Open Enrollment is enroll in Medicare. So if you're just starting Medicare, you're going to be subject to that initial enrollment period that we talked about earlier in the workshop. But if you already have Medicare, this is the time when you can change your plans. You can change your prescription drug plan, you can change your Medicare Advantage plan, you can change back and forth between original and Advantage type coverage. If you want to know more about that, if you want to know more about what to watch out for, how to prepare, what you can do during Medicare Open Enrollment, we have a live virtual workshop just like this one coming up on October 12th, and you can get that information on our website. Any questions? We are at 11:01. No? Okay, so here is my contact information. You will reach me directly. My name's Chris Winterode again, and my email address is chris.winterode@state.nm.us. My direct work cell number is 505-470-4443. Now, we are heading into Medicare Open Enrollment, and I am going to have a lag in responding to voicemails. So because we run around like crazy during Open Enrollment. So I can't guarantee how quickly I'll be able to get back to you if you leave me a voicemail, but I will get back to you. here's the information, and I showed you how to get to our YouTube channel from our website. You can also just go to YouTube and search for New Mexico Aging and Long-Term Services Department to find videos and other information that we have up there about a wide variety of topics. You can follow us on Facebook. You just look for the New Mexico Aging and Long-Term Services Department. We put all kinds of stuff up there to keep you up to date on what's happening with Medicare and also activities through the Aging and Long-Term Services Department. And if you are so moved, I would be very happy if you completed a survey. Let me put this in the chat as well. Oops. I'll put it in the chat to give feedback on this presentation. Okay, we're just a little bit over, which isn't bad since we started late. Any other questions before I let y'all go? No? All right, well, you all have a wonderful day. And once your brain stops exploding from all of the knowledge I dropped on you, if you have more questions, you're welcome to either email me or give me a call. And let me get this, oops, let me get this up here. Sorry, my computer's being weird. I'm going to say it's my computer that's being weird. I think some of you are staying here so you can get that, I hope, get the link from me. Let me get it for you right now. Drop that in the chat. Okay.